So you clicked on this video because you want to know more about stem cell injections, or you want to know just about my personal experience with it. Well, I'll be sharing my journey with stem cells, how it helped me as an athlete, and some of the things you can expect if this is something that you're interested in doing. If that sounds interesting, keep watching. Hey guys, welcome to my channel. My name is Cindy Sember, for those of you who do not know me. In today's video, we're going to be discussing a knee procedure that I recently had. So for those of you who may not know me, I am a 3-time Olympian. I've been a professional athlete for the past 9 years, and I have done a lot of impact on my body. So in 2017, I ruptured my Achilles tendon, and as it healed up, I learned that my ankle mobility wasn't the exact same like it used to be. Having that surgery and having, the stiffness of my ankle change had made my knee become an issue, which throughout the rest of my professional career, I had to run on a knee that was really painful. That was really frustrating for me because I just didn't like that it would swell up. It would feel really hard to train. I still was able to set personal bests with this, but along with that came a lot of damage in my knee. Long term, it had become so frustrating that I wanted an out. I wanted to figure out what was going on. And so I want to talk to you guys about this procedure because some people might be having this problem just like me. Some people might have knee issues, or you may just have some issue in your body that you want to fix, and stem cells can be a good solution for you. It has been for me, and I have done a lot of different things to figure it out. This procedure has really changed the game for me because I was able to go to my 3rd Olympics after getting this done. And I recently got it done again because, well, we'll talk more about that soon. But yeah, so I want to share with you guys a little bit about my journey with this, and I'll also have some footage that you can see from the actual procedure so that you can understand what it looks like, what's going on, and if this is something you're interested in, you can decide if this is for you. Why is my face so itchy? I'm currently in my new house. I just moved recently, so bear with me. The background is not as aesthetically pleasing as it normally is. So a little bit of a backstory about my knee. So I've had knee issues since 2018, and it's just been really hard to train with. Like, it would randomly get inflamed. I'd be like out for the count. Like, I just didn't know what to do in some days because it was so bad. I just couldn't even walk. I'd be going about my business, just daily activities, and I'd find myself limping. And I'm just like, I can't continue to train like this. Like, if I'm training at a subpar level, then I'm going to have subpar results. And so I have to figure out a solution. And so around, I think it was like 2020, 2021, I was doing a lot of squats, and it just got so flared up to the point where I had like a balloon for a knee. And I'm like, I cannot do this anymore. So I went to a doctor. They recommended cortisone injections, which I would not do again if I could go back in time. So cortisone injections are essentially just a Band-Aid to fix the problem. And I felt amazing. Like, I literally got this injection. I'm like, what did I just take? Like, did I just take some type of drug that just helped me feel good? Because yeah, it felt like ibuprofen on crack, and it felt so good. My knee didn't have any issues. I'm like, I feel great. I have a new knee. Everything's perfect. And I was able to run with no pain for about 4 or 5 months, and I was just living my best life. Now, come 5 months later, your girl was back in pain. And I'm like, what's happening? The pain came back with a vengeance. And so looking back now, it gave me a little bit of a precursor before I got the injection to tell me, like, this can lessen your cartilage even more. But needless to say, I decided, what, it worked so well the first time. Track is like one of those things where you have to be ready really quickly. So I'm like, let's get it again. Don't be like me. Do not be like me. Cortisone is not the best solution, okay? Like, if you have other opportunities, go towards those. Don't go towards cortisone because it does something where it's making you feel better, but you're making more damage to the cartilage. And if I could go back now, the first one may have been okay, but doing it twice, not a good idea, because I don't have bone on bone yet, but I do have a cartilage where it's not very stable. So with all that to say, after the second injection, it didn't last very long. I was frustrated once again. And so I ended up deciding, let me figure out some other solution. And so I got in contact with this doctor through a massage therapist of mine, and he was able to do stem cell injections. And this place is called Michigan Regenerative Medicine. It has been so helpful for me to go here because they were able to see my knee. We talked a little bit. I had like a consultation, and he essentially said he believed that stem cells would work for me. Let's fast forward to 2023. So I had gotten the cortisone injections 2020, 2021. The knee was okay in 2022. I was just like kind of, doing everything I can. I did PRP. I did, just anything I could. I was just icing and trying to hold on. So I wanted to make one more point. I also tried PRP, and that helped me a little bit. It didn't help me too much. I know there's people who say they use PRP and it works for them. So that's another option you can try out if you don't want to go all the way to stem cells. But yes, for my situation, PRP did not work. And I also did gel injections. So that was something that kind of kept me going through 2022. I was able to use the gel injections to kind of keep my knee lubricated, just to keep that cartilage from not rubbing together. But that only lasts so long. I needed like a longer term solution. So stem cells worked for me the best. But those are two options. So gel injections and PRP if you're looking for that as well. Back to the video. I actually set a national record in 2022 with all that pain, mind you. So somehow I was still able to run fast enough. But after that, 2023 was just downhill. Everything was going really poorly. I could not continue to keep up my training. Things were getting so hard and I just wanted to give up. So I was able to figure out and get in contact with somebody who was able to help me with the stem cells. And they pretty much told me that they think it'll be a good alternative for me. So essentially what stem cells do is they help rebuild your cartilage. So they take it out of your bone marrow and it's pretty much your own stem cells. So they take it out of your bone marrow, they spin it, and then they put it back into the joint or the area that you're having a problem with. And long term, this helps you rebuild cartilage and feel better. And so I went in about September, after the season of 2023, where I was just like done, things were not going well. I decided to go in and actually get the first procedure done for this. And so went in, got the procedure done. That really helped me. And it was really good to have that because after that, my knee started to be really good. And that whole year was really helpful. And I was able to go to the Olympics in Paris because of that. And I was able to train really hard and everything. So after the Paris Olympics last year, I still noticed a little bit of pain. So I do believe stem cells work. They work because I felt so much better. I was able to do so many different things. However, because I'm putting so much impact on my body, I would say that if you're like me and you're an elite athlete who has pain, it may start to come back up. And one thing I will say is the doctor told me he figured out that if you inject it in a different way, you can get more results. So the first time they were able to inject my stem cells around the joint, this time I went again a couple weeks ago, they inserted the stem cells inside. So it wasn't just around, it was inside. And because of that, I had to go under anesthesia. So let's fast forward to a few weeks ago. The day after my birthday, I literally turned 31. The next day I got this injection and it was actually not as bad as you would think. So it sounds painful, but it really wasn't that bad. So what they had me do is I came in early in the morning. I am headed in to get some procedures done. So I am going to get stem cells for my knee and I'm headed to Michigan Center for Regenerative Medicine and I am doing this for the second time. The first time I did it, it was not in the same location in the knee. They're doing a different location to see if it helps the joint feel a little bit better. So I have to go under for anesthesia today and I'm about to head in now. So let's get going. I got all situated, checked in, did all that stuff. It's a very nice center and they had me change. So I ended up being in a hospital gown. Before the anesthesia, they had me get ready to take out the stem cells. So here you'll see that the process was the doctor has to go in, he has to go inside the bone marrow, like I said, and he's pulling it out. And it takes a little bit of time. It's like 10 minutes, it's nothing crazy. And it's really not that painful. It's just they give you something that's supposed to calm you. I don't know what it's called, but it's supposed to calm you and relax you so that you don't feel, any type of pain there. So it wasn't bad. I maybe felt a little bit of stuff here and there, but I felt really relaxed. I have 2 marks on my back now, so that's the only thing is a little bit of a con of like you might have a mark, but they're so small you won't even notice it. So anyways, after that we went back to the room. When they spun it, I chilled there, so I had to have somebody be with me and my husband John came because I couldn't drive myself since I was about to be under anesthesia. Hello. Okay, so I just got my stem cells pulled out of my bone marrow, which is pretty much the same location I had it last time. I literally had dots on it and now they used it essentially. So I'm very sleepy. They give me some medication that like kind of relaxes you and makes you feel, good. And I feel like great. I can fall asleep. So we're gonna sit here now, wait for about 45 minutes, and then I go in and I do the actual procedure with anesthesia and the injection inside the bone. So I'm gonna rest now.
Good night.
Hi.
If I kiss you, do you wake up?
Yeah.
What?
Yeah. And then afterwards, after they spun it, we waited like 45 minutes and then I went back in and then that's where they put me under. And the funny thing about this whole thing is I was like, hey, I told the lady, there's a lady there and I was like, can you get some content just for my subscribers so I can discuss this thing? And she's like, oh yeah, I'll do it for you. And then I kid you not, y'all, I gave her my phone. They put me under 2 minutes later. And then it felt like the whole thing went about 2 minutes because I woke up from anesthesia, like, okay, so here are the angles I want you to get. And she's like, you're done. The procedure is finished. It's so funny. So I did not feel anything, needless to say. So yeah, that's pretty much what happened is they put you under for this procedure. The one I got, there are, like I said, other ones where you don't go under. You just have a stronger version of that earlier medication that allows you to feel calm and not feel the pain. But if they're going in the joint, they have to because it's really painful if they don't. So essentially, after they did the procedure, it's about a 30-minute procedure. It's nothing crazy. I'll show a little bit of footage here, but just be aware that this is it might be a little graphic. I'll share some stuff. Essentially, it just took 30 minutes. He's going back into the joint, pretty much putting my stem cells back in there, and that's what helps rebuild the cartilage. So after I got back into my life of, oh, just had a procedure done. I didn't even know because I was under anesthesia. I went back to the room. The doctor was, telling me everything went well. I was falling asleep on the table because I was still very sleepy from the anesthesia. John was there getting video of me. All right, doctor husband, how does it feel to have 2 normal knees?
Pretty good.
Anything I need to know since I don't know?
Go easy on your body and it lasts longer.
Thank you. We appreciate that. What was my pain like after this? I felt great. I didn't feel the pain afterwards. It was pretty much more so probably 3 hours after, like when we got back home, I started to notice that I was very stiff. So the only downside is you'll feel a little bit of stiffness for a few days, but it's nothing crazy. It's not gonna take you out for very long. It was just, I felt stiffness in that joint because there was just so much fluid, the stem cells, my body just kind of just regenerating itself. And it was a lot. It was a lot. So I won't say that I wasn't like, hobbling. Well, I was kind of hobbling, but I didn't need like crutches or anything. I just needed to rest it. And so I was icing, I was resting. I can't take any ibuprofen to heal it because they don't want you to take ibuprofen to make it better. So, or because it's going to interfere with the whole process. So I can't take any ibuprofen for 4 weeks. I just do Tylenol. So yeah, the first week I felt a lot of pain there. And you also can't do a lot of impact. So I can't run, I can't do a lot of jumping. I wasn't lifting heavy weights. I could do body weight stuff, but I couldn't do a lot of that. I still haven't been able to for the first 4 weeks. And I'm actually at the 3-week mark yesterday. So that's essentially my story. I will say, like I said, it helped. The first time I got it done, it helped so much. Like if you're somebody who has minimal pain, but still wants this procedure done, I would say that if you just do it once, you'll probably be fine. If you're not running like I was as training for an Olympic Games, you'll probably be fine with doing it once. Yeah, that's a little bit of my own personal journey with the whole surgery. Some of the pros of doing this is you'll have more mobility. Like you will feel so much better after you're done. I felt, like I said, was able to do my functioning. I was able to walk around with no pain like I used to have. It just made a huge difference getting it done. It helps with inflammation. So if you're having a lot of swelling in the area, you won't notice it as much. My swelling went down drastically. What kind of word is that? The swelling went down drastically, and I'm so happy with that because that swelling caused so much pain, y'all. Even just to walk around the block was a struggle. So I'm just really happy that it helped with that. It's just been really helpful, and I chose a really good doctor. Cons would be really just the 4 weeks, you can't really do much. You wanna make sure you're, being smart about that, but you can still cycle, you can still walk, like you can still move your body. You just can't run and you can't do a lot of heavy impact stuff. Another con is price. So it's a little bit pricey. I'll be transparent and say I got a little bit of a discount just because I've worked with them before and we do some social media stuff together. But for me, it was about $1,400 in the US, but I believe it's usually like double that. So it can be pricey compared to like a huge knee surgery or even a knee replacement. This is definitely cheaper. So I would say like it's definitely something that can be costly, but long term, like for your health and well-being, it can make a huge difference. I would say if you're trying to consider whether or not you want to do stem cell injections, I would just, look at just the pros and cons. Like there's a lot more pros, I would say. Another con would be it might take a little bit more time for you to see any progress. So in comparison to cortisone, which is like very instant, you feel it very instantly. This one takes a while. So you're not gonna notice results for the first month or even the first 2 months. It might take some time. You might feel a little bit of like relief after a couple weeks, but you will definitely start to see progress like 6 months, and 3 or 4 months down the line is when you'll see like the most benefit. And so it can be, if you're not patient, it can be a little frustrating because it's like, I just got this thing done, what's taking it so long? Your body's just trying to actually grow the cartilage. Like it's a little bit of a process, so you have to be patient. But that's the biggest con. Everything else, the pros are amazing. I'm really happy to have gotten it again. Like I said, I probably wouldn't have gotten it again if I hadn't been training for an Olympic Games, just because I've been doing such high intensity stuff. But it's just like, at this point, it was more like maintenance for me. But if you do it once and you're somebody who's not training that high, you probably will be fine for a very long time. So yeah, and even the doctor, one thing I will say, he compared my cartilage to before the injection to after the injection, and he definitely saw a little bit of growth. So my cartilage definitely did grow back a little bit, and it's really encouraging to see that. All right, guys, I'm here with Dr. Navdi. He just did my procedure. Thank you so much for all your help. I really appreciate it.
Yeah, you're welcome. Thanks for having us.
Yes, I just wanted to ask you 2 questions. So, can you just explain to the people what we did today and like what the benefits are?
Yeah, so you have osteochondral cartilage loss, which is the cartilage on the end of your femur, prior from the impact.
Yes.
And so what we did today is a comprehensive approach to the knee, where you're looking at the knee like a functional unit. So we're tightening up the ligaments that hold the knee in place. And the big part and the most important part of what we did for you was we injected the stem cells underneath the cartilage in what's called the subchondral bone to help regenerate those cartilage from the inside out.
Cool. And then, is there anything else that you want anybody to know who might be interested in getting this procedure done?
Yeah, so the way that stem cells work isn't as easy as we advertise. So the kind of easy explanation is you take stem cells out of somewhere in the body, usually the bone marrow, but it can be the fat, and then you put them in the knee, and those cells become knee cells. In reality, there's an intermediate step. So those cells stimulate the native cells to make more of themselves. So I tell people it's a bit like multiplication. And any time you multiply a number by 0, the answer is 0. So if we wait too long, if we wait until the cartilage is gone, you're really not a good stem cell candidate. And if you wait until there's a teeny tiny bit of cartilage left, just like any number you multiply by a teeny tiny number, you're not going to get a very large response.
Right.
So if you're thinking about a stem cell procedure, to answer your question,
yes.
If you're thinking about a stem cell procedure, the sooner you can come in for an evaluation, the better chance we have for getting a good outcome.
Perfect. Well, thank you so much. We appreciate you.
You bet.
Thanks.
Thank you.
Do I recommend getting stem cell injections? Absolutely. I would say it's made a difference for me. I would say try this out before considering a knee replacement or, taking those extensive invasive surgery options first, because yeah, it just adds up and you don't even know if it's gonna work for you. A knee replacement is definitely something that you don't wanna do early on in life. I think it's a really good thing to do and something to consider. I'm really happy because now once it's all good and done, I can go back to running and hopefully feel more relief. It was a really good time to do it because I'm not currently competing or training heavy right now. So this is a really good time for me to try this out again. I hope you guys found this video interesting. I hope that it gave you some insight as to what this procedure was like for me. I definitely had pain, but it wasn't anything crazy. And a few days after the injection, I definitely noticed like I could not walk very well. I didn't like that, but temporary pain for long-term benefit is worth it for me. So if you guys have any questions, definitely leave them down in the comments. I will answer anything that you want to know. I hope you enjoyed this video. If you did, give it a thumbs up and subscribe for more content, y'all. I produce fitness content, so if you're somebody who wants to work out and wants to figure out how to get in shape, I share that. I share some lifestyle content as well, just to keep it a little entertaining. So definitely subscribe, and I will see you guys in another one. Bye.